knock, identify, gate, explain my procedure, and provide for privacy. I'll be given oral and topical medications. For the oral, I want to make sure I don't want to crush, extend it, or tear, release tablets, or alter them in any way. And I would verify doctor's orders for both medications before giving them. And when I get my medications ready, I would do 6 rights of medication administration rights, which is right drug, right dose, right documentation, right route, right patient, right time. And also, before giving the medication, I would want to check my 3 checks, which is as soon as I get out of the MAR, look at it, make sure it's right. Then scan it with the MAR, make sure it's right again on the computer. And then before giving it at bedside, I want to check it again. I also want to check the date, make sure it's not expired. Or like, and then I would, I think that's it for that one. And then I would wash my hands, put gloves on. Hi, I'm Brooke. I'm going to be your nurse today, and I'm going to give you some a topical and oral medication. Do you have any allergies? Okay. What's your name and date of birth? Okay. And when giving her this medication, I would make sure she's just sitting up so she's not choking when I give it to her, because it's oral, it's a pill. I'm going to give you this medication. This is going to help your blood pressure, because your blood pressure was 188/88, and this is going to help lower it. Okay? Give her that. Wait till she swallows it. And I would have her open her mouth and put the tongue to the roof of her mouth to look for pocketing with my pen light. And I could also massage her jaws to make sure she's not pocketing anywhere there. Then I'll come back 30 minutes later to check her blood pressure again to make sure the drug did its therapeutic effect. And I would document that on my MAR. And make sure she doesn't have any adverse reactions or anything like that as well to the medication. And then I would take my gloves off and wash my hands, put new gloves on, so I'm getting ready to do the topical one. And for the topical, I have gloves on. I'm gonna wash with soap and water, make sure the area is good and clean, and ready for the ointment. So I'll take a little bit of this. Do you have any allergies? Okay, I would verify doctor's orders again as well, and all that good stuff. Gloved finger. I would get a little bit. Now I would rub it on her leg. And I would leave her setting in an anatomical position for good absorption. And I would come back and make sure there's no adverse reactions or anything like that. And then I would document that as well on the MAR. And take my gloves off, wash my hands, and record, and make sure she's comfy and give her a call out and all that good stuff if she was in a bed.